Just waiting, and we should be up and running and live. Hi, everyone. Welcome Monday night. It's your much requested Medication Monday, I think is what we decided to call it, right, Linda?
Yes, Med Monday.
Yes.
Yay.
Med Monday. So welcome back. I'm Elizabeth. I'm one of the CNY travel nurses. Joining me tonight is Linda, Nurse Linda from Unboxed Mom. She's one of our consultants with Metro Drugs. So she's here tonight. We're going to talk everything about meds. So in the past couple of weeks, I've gotten quite a few comments about, just folks wanting to have more focus on medications and how they're used, what they're used for, how they're given, et cetera. So while we wait for folks to kind of hop on, Linda, I was thinking a lot yesterday about how tough Mother's Day is for a lot of different reasons. My mother has passed away. And so for me, that was like a hard reflection point. But, I think a lot about our clients who have been on this journey for a really long time, and, them just, what wisdom do you have, or what's some of your sage advice for this season?
Yeah, I'm glad we're acknowledging this, because I feel like for a lot of people we know, it's just a day to get past and just make it go by as soon as possible. And that's hard when it's supposed to be the celebratory, it's springtime, there's renewal, and everyone is touched by it in some way, like you said, whether it's a mom who's passed away. My mom's in a nursing home in New York, who struggled with health issues. Everybody's kind of has that situation. And then to take on going through fertility treatment and it just being everywhere you go. A lot of times for people I've talked to over the years, I've said, let it be a day where you duck out. If you just want to binge watch for the whole day, all those kind of things. But I think it lingers through this week a lot of times. And so for that, I often say, be kind to ourselves this week, take time for ourselves this week. Just kind of self-nurture. A lot of times I've been talking lately about this with social media. There's this like behavioral transference that's going on where you're reading things about somebody who's struggling or somebody who's experienced a loss, and you have empathy for them, but you're acquiring their pain also. And then you're carrying that with you forward. And so as much as it's great to get involved on social media, I'm very active on social. I also say that sometimes to be careful with it and take time and distance when needed.
Yeah, no, absolutely. Like acknowledging those feelings. And I think, it's definitely possible to, celebrate with others, even if it's something that you don't have. But there's something very specific about the journey and motherhood itself that it definitely makes it a hard day and a hard week. And so I think it's just to, being gentle with yourself and knowing that, you're going to get there. There's going to be a path forward. We don't necessarily know what it is, but we will figure out a path forward one way or another. So, well, everybody, thanks so much for joining us. We have lots of people that are hopping on, not as many as we normally have at this point, but hopefully people are going to be coming around here soon. But tonight, we're going to talk all about medications. So, Linda is a rock star in this department. She does a lot of teaching with our clients for Metro Drugs. So if you find yourself with meds that you don't know how to use or you are confused about, Linda's going to be your right-hand person to kind of help out. But tonight, we just wanted to literally go through the meds one by one. We definitely will answer questions at the end. I know last week people were super excited because I answered questions for the whole hour. So I'm seeing the questions drop in, but we will totally get to some questions, but we're going to try to focus as much as we can about meds. So first, let's talk about the meds in general are taken. There's different purposes for the meds. And so we'll go through each med and its purpose, but we like to kind of block the meds out into two sets. So there's the stimulation medications, and those are the meds that you're going to take to get you to retrieval. And then you've got your transfer meds that you're going to involve when we're doing a transfer, whether that's a fresh or a frozen. So Jessica, on PIO shots, we're totally going to talk about which gauges to use and all of that. So we're totally going to get there. But so for the stimulation portion, the primary meds that we use are going to be Follistim or Gonalef, which Leslinda always says is like Pepsi and Coke. They do the same thing. They maybe act a little different, but they pretty much do the same thing. And then usually for CNY clients, we use either Menipure or Hcglh. So we'll talk about that, both how to mix, how to inject, etc. And then we are going to almost always, we're going to use what's called an antagonist medication, so that as we stimulate the ovaries, at some point they're going to freak out and go, oh gosh, why are all these follicles in here? It's time to ovulate. And so there's that third medication. It's usually introduced around stimulation day 5, 6, sometimes 7. But once follicles get to a size where we're going to start worrying about that ovulation ahead of schedule, then we're going to involve that. Then we'll talk a little bit about triggers, and then we'll talk briefly about PIO and some of the transfer medications. So Follistim, starting us off. Follistim is used for stimulation. So it mimics the hormone that your brain, your pituitary gland, is secreting naturally each month. And you might have seen this in your baseline labs. We draw an FSH, or follicle stimulating hormone. And that's just to help us understand. So follicle stimulating hormone in the blood is going to be at its peak somewhere around cycle day 3 or 4. So that's why we like to see what that number is, because it tells us how hard your body is naturally working to develop a follicle. But because we want to stimulate, grow, and retrieve as many eggs as we can, we are supplementing our brain's own FSH with Follistim. So Linda's going to show us the mechanics. How is Follistim packaged? What does it look like? How do you give it?
Okay, let's do this. So as you've mentioned, Coke and Pepsi, Follistim and Gonalef. I'm going to show Follistim, which is a pen device. These are plastic pen devices either way. The Follistim comes in a package with needles, and you will have a separate box, probably multiple boxes, that will contain the actual vials of Follistim, which are the medication. So this is going to deliver the medication the way you're going to inject it. This is actually the medication. As Elizabeth was explaining, these are going to stimulate your ovaries. So it's going to give you concentrated doses of FSH to recruit as many follicles as possible. Follicles meaning eggs, because I know we use those words interchangeably sometimes and it can confuse people.
Good. So very good point.
Our goal here is not to show all these meds and then cause like brain explosions of, whoa, that's so much. It's just, these are quick demos. If you, for example, if you get your medications for your protocol through Metro Drugs, we can schedule a FaceTime, you'll have my cell phone number, and we can run through these much slower. But to give an overview, just so we can set expectations, what we do pretty quickly is we remove the cap, we separate the pen device, so you have 2 halves. You take the vial of medication. There's only one way to actually go through it, and you actually put it down into the dropper and twist it on. And that way, it's just lined up. There's no other way to put it on. You have the vial in the plastic device. You take a needle. Every time you inject, you're going to put on a new needle. You twist the needle on. It's like righty-tighty, lefty-loosey. You twist it on. And the needle is in the cap being protected, which just popped off. So it basically comes right off. There's another cover on the needle, so you can't hurt yourself until you pull this off. These are tiny, tiny needles. They're subcutaneous. They go in fatty tissue. They're so soft that I've had patients who have bent the needle by trying to put it in, and just because they're going so slow in. So I'm going to show you really the right, I don't want to say the right, but the correct way to do it where it causes the least amount of discomfort, let's say. There is no real wrong way to do this. You can't hurt yourself with this little needle in doing it the wrong way, but we like to teach it in a style in which it's best for you. So you will dial your dose according to what CNY prescribes. The way that this pen device is dialed is you dial it towards you. So I'm dialing it as if I am you going this way. And I'm going to dial a dose to say 175, random, okay? The trick with this pen device is that if you dial past your dose, you typically instinctually would go backwards, but that can squirt out medication if you have your needle on. So you will never, ever do that because we know this medication is costly. You're just going to keep dialing it till it goes all the way, and then you're going to smack it back in, and that's resetting your pen. So I'm going to dial it again to 175. You're always going to wash your hands, have an alcohol swab to wipe the area in your belly. The way that I typically recommend holding this pen is with your thumb up, not really down here because it's hard to squeeze this then. So you can hold it with your thumb up. This is kind of your trigger button. You don't want your finger on the trigger until you're in. So you're going to pinch up the skin. You're going to go straight in. 1, 2, 3. You're going to click down. It's clicking and dialing. Once it stops, you've expressed all of your medication. Pull it straight out. So you've administered your Follistim. You'll do that as your instructions are told. To recap the needle, you just put that big cap on, twist it off to the left, and it's going to remove that needle. Put that in a sharps container. Go ahead and put the cap on the pen, put it back in your fridge, and then use it the next night.
Yeah, that's perfect. And there's a couple of my own little tips over the years that I've come up with Follistim. One is that the vial is just like putting a battery in a flashlight. Yep. And so if you put it in the wrong way, the flashlight won't turn on. If you put it in the wrong way, the medication won't do anything. In fact, it's actually you can't really even screw it together if it's the wrong way, because the little pin or that little stick there is intended to go inside the end of the empty vial.
Yeah, exactly. It'll block it. Yep.
It'll block it. Yep. And then my other little kind of secret is I always tell clients, don't put the needle on until you get the dose to the right dose, because then you won't have that sort of accidental, like, oh shoot, I dialed it to 300 and I go backwards. And then as soon as you go backwards, if the needle's on, off it goes.
Exactly. And so in real life, don't put that needle on until the very end.
Yeah.
And then
and again, there's really, there is a wrong, but there's a lot of right ways to do this. And so if you are a pro and you found a way that works, do not let us convince you to change your ways. Mm-hmm. This is just a great, I always tell clients that there's a million different ways to get from New York to LA, and fertility is the same. There's a million different ways to do these things. And so I think a lot of it is just finding what works for you. I'm getting a lot of questions, Linda. I don't know if you can see questions on your side this time. If you hit the comments button, I know last time you weren't able to see them, but I'll just, I'll throw them over to you. So a couple of people are asking about the Follistim overfill. And like, what do you do with that? Are you left to give yourself 4 different injections from the overfill? What do you usually suggest?
Yeah, let's talk about that. So I always say when I'm talking to everyone privately, and this is really good to know in general, if you have Follistim and you took a dose of 300 out of a 300 vial, let's keep this simple for math purposes, theoretically that vial is empty, but there's always overfill in the vials. So we want you to hold on to those vials, keep them in the refrigerator, because again, Follistim gets refrigerated for proper storage and temperature to maintain the potency and the efficacy of that medication, and keep those vials. If you are getting close to running out of meds, you don't really need refills, you know you have enough, you can give yourself separate injections to get to your dose. So let's say you dialed your dose to 100 and you gave yourself 75, it stopped at 75. Then you know you need another 25 units from another vial. So yes, there is some overfill, which obviously can be a savings. We can talk about that. And I can also actually help you with manipulating that so that it's a little bit easier to administer.
Yeah, absolutely. So there's definitely a way, I don't know if this is a condoned way of doing it, but you can certainly combine vials too to prevent, having to give yourself 3 injections. So you can always use an insulin needle or something like that, clean the end of your vial and extract what's left over and then put it all into one vial. And so
can we show that right now? Let's do that.
Yes,
okay.
Absolutely. Because that's a good one to, like I said, to prevent having to give yourself multiple injections, which, let's face it, half of us are terrified of one injection. So
yeah. So these are baby insulin syringes and needles. They come with an orange cap, and you actually take your vial, put it through the stopper, and then you can withdraw what's in that vial that's left over. And then That way you have your measurement, you know how many units, and you know how much you need to give. So that is a nice little, I don't want to say trick, but it is a nice trick
Yeah.
to save yourself some money.
Yeah. Absolutely, because every dime really matters. So
Absolutely.
I'm getting several questions about Gonalef or Follistim, which is better for this and that and the other. Honestly, folks, they're really the same drug. They're different manufacturers, so it's kind of the difference between ibuprofen is the generic name, and Advil or Motrin are the brand names. They both have the same drug effect, the same pharmacology. All of those things are the same. They do the same things. For most people, it just comes down to cost. And so maybe your insurance covers Follistim, but not Gonalef, or maybe who knows, there's a different reason for everything, but truly and completely, they are 100% interchangeable. So let's say you had some leftover Gonalef leftover from your last cycle. Now this cycle you have Follistim, completely interchangeable. I always just say, and I don't necessarily know if this is from a science perspective or just in general, I always say just finish out one and then switch to the other. So don't do Gonalef one night or partially Gonalef one night and partially Follistim the other night, but at the end of the day, they do the same thing. So
yep. The Follistim comes in that pen device. This is the Gonalef pen. It's red and white. As Elizabeth mentioned, they are the same. They are FSH. They are pre-filled pens that you put vials into. They're just different brand names. Yep. I will say that for Metro, for example, Follistim is the preferred medication, so it's at a lot lower price point. When you start doing research on cost and you get your quotes, you will find out which is best for you, probably for that reason.
Yep, definitely. And there's a couple of comments which I was going to bring this up, but there are 2 savings programs that can help with the cost of this specific medication, and the ganirelix and the cetrotide that we're going to talk about. The Follistim program is called Reunite Assist, I believe it's called now, or Reunite RX. You can go to if you just Google that, Reunite, it's one word, and then RX or Reunite Assist. There's a program that you can it's income based. I believe they ask for your tax returns or something like that. But it can be a really significant way to save some money. It's not on all the drugs, but it's even a few of them. It matters. So Reunite Assist is the Follistim savings program. And then I want to say the other program is called Fertility Lifelines.
I don't know if it's compassionate care or...
It's compassionate care, but I think the website is... Anyway, it's compassionate care is definitely the program name, and then Reunite Assist is the other program name. Yeah. And either one, apply for both, do what you have to do to see what money you can save. So
Reunite Assist is a savings program. Let me just add real quick, Elizabeth, that it also has Reunite Reassurance attached to it, which is for Follistim and ganirelix and Pregnil, I believe. If you were to have a positive COVID test, you would not be risking loss of money of medication. They would reimburse you once you show that you had a positive test that interrupted your cycle. So it's a little bit of assurance.
Yep, and I have used that. I have used that before for several clients who are able to get all of their Follistim and Menipure and ganirelix reimbursed. So in that devastating moment where you're COVID positive and you can't go to retrieval, that is a huge, huge, huge benefit. So, okay, I hope that answers those questions. Let's move on to Menopures. So for CNY clients, this is something you may or may not have. Most of our clients will get the FSH component, which is going to be the Follistim or the Gonalef if you have it. And then you're going to get Menopure or Hcglh. So it's going to be one of the 2. So Menopure is also FSH, but it has an LH component to it, which can help with egg maturity and growth. And so not one or the other is necessarily better. It's really up to, sometimes it's up to cost, but sometimes it's up to, some of our physicians prefer the Hcglh, which is the low dose microdose Hcg. For some of our diminished ovarian reserve clients, some don't. So it's really kind of up to your individualized discussion and protocol with the provider. But with all of that said, show us, what does Menopure look like? How does it come? It's a little bit more complicated, right? Because it is,
let's be fair. Yeah, let's keep it real. So Menopure comes in boxes, 5 vials of what I call powder. That's the medication. And then 5 vials of the water, which is a diluent. So it has to be mixed. These are room temperature boxes that can just stay out on your counter. The way that it comes is you will receive a whole bunch of 3 ml syringes. When we talk, we go over this, and I usually say to put Post-it notes on things so you know which ones to mix with, but it does, believe it or not, once you do it a few times, it all does make sense. You're going to actually inject with the same size small subcutaneous needle like you do the Follistim or the Gonal-F. So in this case, it's a 27 gauge half-inch needle. But the cool thing about Menopure is that they come with something called a Q-cap. And a Q-cap, do you teach with this, Elizabeth?
I do. Yep.
I'm a fan because it really reduces the risk of losing medicine, right? Of losing valuable medicine and doses, so you have accuracy. So what you typically will do is you will twist on your syringe this Q-cap. It's righty-tighty, lefty-loosey, okay? Then you're going to go ahead and you're going to take the amount that you have prescribed to you. So if you have 150, give me a dose, Elizabeth, 150 or 75?
Yeah, it's usually 75 or 150, occasionally 225. But just let's do 75, keep it super simple.
Okay. So 75 is going to be, each powder vial is worth 75. You're going to take a powder vial, you're going to take a water vial. You're going to mix it by taking the Q-cap with the syringe and basically popping it on over the water vial. It's going to fit securely right over the top. You turn it upside down and you're going to withdraw 1 ml of that fluid into the syringe. You just pull the water vial off. You take your powder. You put the Q-cap, kind of hard to twist it on this way, but you basically pop it right on powder and you squirt, bless you, you squirt that water into the powder and it instantly dissolves. You don't have to shake it. You don't have to throw it around because then you just get bubbles and everything, but it's going to dissolve. And then you turn it upside down and you retrieve the 1 ml that you injected. So if you put in 1 ml, you need to come out with 1 ml. If you've gone in with 1 ml and you come out with 0.5, you're leaving some of your dosage in the vial and you need to push it up and pull it back down so you have that full 1 ml. Once you have your 1 ml back out, you can actually twist off the Q-cap with the powder, twist on your 27 gauge half-inch needle, which you're going to use to inject. You're going to clean the area with alcohol again. You're going to pull off the cap, hold it like a pen. So I usually say if I see people really hesitant and scared, they're holding it back here because they don't want to be close to that needle, but that offers less control. You kind of want to choke up on it so you have full control. Pinch up the skin. You're going to go straight in 1, 2, 3, and then push down to inject and pull it straight out. I know that there's a tendency to be hesitant and to just literally push it down slowly into the skin. You can do that. It might cause more discomfort. So if you can kind of get yourself to kind of use your wrist and just go 1, 2, 3 straight in, it's a lot easier. And then just pull straight out. Yeah. And then again, this all goes in the Sharps container.
Yes, absolutely. And definitely these injections are going to go anywhere on your belly where you can pinch up some skin. So my little spiel on this is a minimum of 1 inch away from your belly button. But anywhere you can pinch up some skin. Try not to abuse the same spot of skin over and over and over. If you have a bruise there, avoid it. But most of us have skin we can pinch up on different parts of our abdomen. And so just share the love, move around, pick a new spot every time, however you want to do it. But definitely goes in the belly, a minimum of 1 inch away from the belly button, but really anywhere you can pinch up skin. I've had clients do it in the back of their arm. That's where a lot of diabetics give their insulin injections, which are sub-Q. The whole idea is we want to make sure it's fatty tissue, as that's how the medication is best absorbed. So, so that's perfect. So yeah. And then can you briefly show us if we were Menipure 150? Because I think the Menipure 150 confuses people sometimes.
It does.
So,
it does, absolutely.
And it's literally just one extra step. But I have had clients call me and say, well, I'm having to do 2 shots. And I'm like, no, you don't have to do 2 shots. Let me show you a little trick.
So as Elizabeth is mentioning, you're going to have 2 powders for 150 because those were those 75. The value of each powder vial is 75 units. So you need 2 powder vials to make 150, but you're still going to only need 1 ml out of your water vial. So once you've gone ahead, you've pushed that water, that 1 ml into your first powder, you pull it upside down, you withdraw that fluid to 1 ml. You take off that powder vial that's now empty because you have your medication, your 75 in that first 1 ml. You take your second powder vial, you push it on that, you squirt the fluid in. Now you've concentrated in 1 ml 2 powders. Does that make sense?
Yep. And that's perfect.
And even if you have 3 powders, you do the same thing. You withdraw and then you put it on the third powder, you push it in, you pull it back out. So you're concentrating more, but you're not adding volume.
Fluid.
It's the same 1 ml. Yep, exactly.
Yep, you got it. That's perfect. I love that. Thank you so much for clarifying that. So, and then the Hcglh, that's the alternative to Menipure. I cannot say that I've seen a time where somebody was on both Menipure and Hcglh. Right. So usually it's going to be an either or. And obviously if you have questions about your own specific protocol, let us know. But the Hcglh does not require mixing. It's going to come in a vial. It's already made or compounded. And so your job is just going to be to withdraw your dose. So Linda and I were talking about this earlier. The majority of the time, the dose is going to be 20 units. So what would that look like?
So in our little insulin syringes, I call these kind of the baby ones because they're really tiny. What you'll see is you'll see 10, 15, 20, 25. You can pull down to the 20, and that's basically filling it with air. Okay. And then you're going to take your vial and you're going to remove the cap. You can clean it with alcohol. You're going to push the needle onto the vial, push in that air. Kind of makes it a little easier to withdraw the fluid because you're going to be withdrawing fluid a few times. You're going to do this. Is it daily, Elizabeth, that they're going to be doing this?
Yep. So Hcglh is going to be done. Yep, exactly. It's going to be done every single night with the Gonalef, so one, or with the Follistim, one right after the other, same time each night. And if you start at 20 units, it's always going to be 20 units.
So I've pulled up to 20, and I'm just going to clean the area with alcohol again. I'm going to hold this like a pen, again, kind of holding it close to the needle, pinch up the skin, go straight in and inject, and then pull it straight out. And then again, goes in Sharp's container.
Yep, that's perfect. And just to play off of what you were saying, not everybody teaches add the air before you remove the volume. But the idea behind this is that there is a vacuum, or there is a water to air gradient, if you will, in that vial. So because you're going to be withdrawing from it several times, if all you do is withdraw medication and you don't replace that volume with air, at some point what can happen is when you withdraw the syringe, medicine will spray out, because that water to air ratio got off. So that's kind of that idea, is if you're going to take out of a multi-dose vial, if you're going to take out multiple times, just get in the habit of pull down on your syringe to how much you're going to take out, inject that air, and then take, so you're trading air for medication. I don't know if that helps, but
and just
I have
to mention with that, if
the medication just sprays out.
If it's missed, if you don't inject the air, it's okay, because you're withdrawing the right amount of medication, and that's what's important.
Exactly. Yep. And that's exactly what's important. So, okay. So that was your Follistim or Gonalef, your Menipure Hcglh. Most of the time, you're going to start out with just those 2. So either Follistim or Gonalef, and then either Menipure or low dose Hcg. And so we start you out small. Those are the ones that are going to usually be the first couple of nights. And then when we tell you to, we will introduce a third injection. And that's the one, I always use this example that we're putting on the gas to generate these follicles. But at some point, your body and your brain are going to be like, whoa, we've never had this many follicles before. Like, brain, don't you think it's time to send out some LH and tell those guys to get out of there? So the Cetrotide or ganirelix prevents that LH signal from going and telling your ovaries to ovulate. And so ganirelix is going to be, at least for us here at CNY Fertility, and if you're watching and you're not a CNY client, welcome. We love to have you, but make sure you follow your own guidelines. But we are always going to instruct you to give those in the morning. And the reason behind that is you'll always trigger when it's time to take the trigger shot to determine your retrieval. You will always trigger at night. And so we like that Cetrotide or the ganirelix, that one that's stopping ovulation. We like that to be the morning of the trigger. So in general, if you've been doing it in the evening, do not worry, but we do like it to be in the morning. So show us how the ganirelix works. What's it come in?
Yeah, ganirelix comes in a box. It is pre-filled. So I usually like to say it's one of the easiest. It's stored at room temperature and it's no mixing at all. It's small. It's almost in the similar size as an insulin syringe with a needle. You just clean the area with alcohol. You're going to pull off the cap. We're going to hold this just like a pen again so we can easily manipulate it, pinch up the skin, go straight in, push all the way down until it goes down, and then remove it.
Yeah. And that one is just literally, I love ganirelix. It could not be easier. There's no mixing. There's no deciding what needle to use. It's literally just pull off the cap and head to it. So,
and it's a one-time use.
Yep. And it's a one-time use. Exactly. So everything that's in that pre-filled syringe is one dose. And when it's empty, it goes in the sharps container. And so if you have a medication called Cetrotide in its place, that one's a little bit different. It does require mixing, but it's quite similar to the menipure in that there's liquid that's added to powder. Once it's reconstituted, it's injected. So if you have any questions about that one specifically, we're not going to demonstrate that one, but if you have any questions, let us know. Okay, so you've taken your stimulation medications and you've gone for your monitoring, and then we've said, okay, I want you to start your ganirelix. We don't want you to ovulate. So now everything is going, you're taking those 3 injections, and then you get to a certain point where your ultrasound and your lab say, look, it's time to go. We need to take a trigger shot to prepare for retrieval. So the trigger shot is you're going to use 1 or 2 meds, sometimes both, sometimes one, sometimes the other. But the trigger shot is intended, no matter which one you use, is intended to do the same thing, which is your egg is inside your follicle, but it's attached to the wall of the follicle. I always say I'm horrible at charades, so bear with me. But it's attached to the wall of the follicle on like a little beanstalk. And so the trigger shot is the signal to that follicle and the egg inside to release, so that when we go in with the needle to suction it out, the egg comes with it. It also tells each egg to enter its final phase of maturing, so that when it is extracted, it's mature and it's ready to be fertilized. So 2 different trigger shots that we primarily use. One is a Lupron trigger, and the other is an Hcg trigger. So Linda's going to show us in just a second, but I think it's really, really important to recognize that what we're telling you tonight, these are general guidelines. And so specific to the triggers, everybody triggers with something different. So it's based on a multitude of factors. How old are you? What is your AMH level? How many mature follicles do you have? What is your estrogen level? Understanding and computing all of that is how we determine whether you're going to trigger with just Lupron or Lupron and Hcg, and how much of one or the other. So let's do first Lupron. So the doses of Lupron are always going to be the same. So whether you do 1 Lupron or you do 2 Luprons 12 hours apart, it's always going to be 4 milligrams of Lupron, which is equal to 80 units on an orange insulin syringe, or 0.8 milliliters if for some reason you don't have the Lupron syringes or the insulin syringes. So show us what is this going to look like?
So it's going to come in a vial. It gives you more than enough for 2 doses. So 2 Lupron triggers if necessary. So as you're explaining, based on the dose that they're going to be doing, you can pull back to get some air into that vial. If you don't do it, it's okay, but it might make it a little easier to withdraw the fluid. You're going to put it into the vial, push down, and then you're going to hold it upside down. You're going to withdraw that amount. So this needle has been used a few too many times to demo, but you're going to pull down until you've withdrawn all the fluid. You're going to clean the area with alcohol, and you're going to pinch up the skin, and you're going to inject that amount in.
Yep. And so that amount for CNY purposes is always going to be 80 units, 80 units with that orange insulin syringe. But your vial might say on it, inject 4 milligrams and repeat this dose 12 hours later.
Right.
And so just know that some of the prescription orders that go in are just kind of standardized, but we really like to tailor each individual trigger to your individual situation because you're not everybody else. And so if we blanket trigger everybody with 10,000 units, we're going to have a situation where a lot of people are going to have OHSS and there's going to be, there's going to be concerns. And so it's always super duper important to follow the written instructions and the verbalized instructions that you discuss with your nurse. So the first trigger shot is always going to be in the evening, because it's 35 hours from the trigger to the retrieval. And so triggers are always at night, and then retrievals are always 2 days later, but in the morning. So the Lupron trigger, if you're just doing one, then you're most likely going to also be doing an Hcg trigger, which we're going to talk about in just a second. Whereas if you're doing 2 Luprons, it's going to be both the same med, same dose, same spot in the belly, but 12 hours apart. So very important. The trigger time is married to the retrieval time. So if you trigger an hour late, then we're going to go to get your eggs, and that whole process that I mentioned with the egg releasing and maturing and all those things, it's going to be an hour behind. So if you trigger an hour late, that egg might not be ready. It might not be available. And on the contrary, if you trigger an hour early, we might go to get those eggs and they might be gone. So when your nurse tells you you're supposed to trigger at 12, midnight, whatever time it is really important that it be done at that exact time. So for Hcg triggers, and that's going to be either Hcglh, which we use very infrequently for IVF, but we do use it, or some form of Hcg. So what's going to be called Pregnol, Novarel, or the long generic name is human chorionic gonadotropin. So in every case, except for Hcglh, but in every case of Pregnol, Novarel, human chorionic gonadotropin, it's going to be powder and water. So you're going to have to reconstitute the powder, but make sure that you inject very specifically the amount that your nurse teaches you. So let's go through a couple of scenarios. So Linda, if I was telling you we're going to do a 10,000 unit trigger, show me how that would be done. Show me how that looks.
Okay. So hang on here. I'm having a problem with my syringe. 3 ml syringe, 22 gauge needle. Okay. This needle is going to look very big. This is not what you're actually going to inject with. You're just going to draw up. So the way these come is Pregnol, Novarel, they come in a box. You're going to have a big vial that's going to say bacteriostatic water. And then you're going to have one that's going to be the medication name. So Pregnol, Novarel. These are going to be room temperature stored. You don't have to put them in the fridge. As Elizabeth was explaining, I don't think we could emphasize this enough, right? This is a time sensitive trigger shot. So I usually say, highlight this one. Know that this one is different than any of the other ones when it comes to your instructions. You're being given an exact time for a reason, and it's really important to adhere to that time. So, we will we will do the trigger shots in different doses. I think what I'll do is I'll draw 1 ml and I'll put it into the powder and withdraw that.
Yep.
Just because it's easiest. So we're going to go ahead and we're going to take off that needle. That's that cap on that needle. We're going to pull down to 1 ml to fill it with air. We're going to take the water vial. We're going to put the needle all the way in, push down on the plunger, hold it upside down. You're going to make sure that the tip of that needle is under the water, right? And then you're going to pull down so you retrieve 1 ml of water. Pull it off. Now you're going to take your powder vial. You're going to take it, put it straight onto the powder vial, push in or squirt in that fluid, and now you're mixing that 1 ml in the powder. So it's diluting it, it's mixing it. You don't have to shake it around too much. You can just kind of swirl it if you want to. And then on the upside down side, there's only one trick really, which is that the needle is up here. The fluid is down here. So you have to pull your needle down so you can visually see the needle has to be under the fluid, under the water line to withdraw that 1 ml. So you're going to go ahead and pull it down till it gets to the 1. Go ahead and take it off. And then you're going to carefully recap it. So you can leave the cap down on your table. You can scoop it up, which is usually the best way to do it. Twist it off, so lefty-loosey. And then you're going to grab your 27 gauge 1/2 inch needles, twist it on righty-tighty. Clean the area with alcohol, hold like a pen again. So there's repetition here. Pinch up the skin, straight in, push all the way down till you've injected all the fluid and pull it out.
Yep. So so one quick thing I want to say about the trigger shot is on the box itself, this very well may say for intramuscular use only. So, or you might Google, or you might ask on a Facebook group and somebody says for intramuscular use only. So just know that we advise that your HCG trigger be given subcutaneously in your belly. Effectiveness wise, it works the same. And it's just one less scary big needle that you got to inject in the backside in the muscle, because we all know that that's the most terrifying part of everything. So, and then just very important, just like there's going to be a very specific time for the trigger shot, there's also going to be a very specific amount. And so that amount, like I said before, it's determined for each individual client. It's determined based on what your estrogen level is, how many follicles you have. Basically, how much of a risk do we think you are for ovarian hyperstimulation syndrome? Because HCG is the fuel that feeds the fire of OHSS. Mm-hmm. And so if we think you're at a big risk of OHSS, we're not going to give any fuel to that fire. We're just going to give you instructions to trigger with 2 Lupron, 12 hours apart, same dose. But if we feel not too high of a risk, we'd like to have some HCG involved, then you might get a 5,000 unit dose or even a 2,500 unit dose. But like Linda was showing you, the vial only comes in 10,000 units of powder. So whether you dilute that 10,000 units with 10 milliliters of powder or 1 or 4, there's still 10,000 units inside. So usually if we're going to instruct you to do a 5,000 unit trigger or even a 2,500 unit trigger, we're going to teach you how to dilute it so that you can easily get that out. So I like to, for example, if you're doing a 5,000 unit trigger, I still have you pull up the 1 milliliter, inject it into the powder. Now you have 1 milliliter and 10,000 units, but I only want you to have 5,000 units. So then you take a 0.5 milliliter. And there's a bunch of different ways you can do that math. So always follow your nurse's instruction. But there are very specific reasons that we ask you to do it a certain way. So a couple people are asking, well, why is it always 1 ml? Well, it's because 1 ml is the nice magic number of what can be absorbed easily into your subcutaneous tissue. Mm-hmm. You can inject up to 2 milliliters safely, but why when you can just put 1 in? So if you've ever injected, which I'm sure nobody, well, I don't know, but when I went through this process, I was really interested from a learning perspective of what different things felt like and were like. And so I tried once doing 2 milliliters to inject my Menopure, and it was like kind of like a sloshy little like a bubble. So 1 milliliter just seems to be well tolerated. It absorbs quickly and it doesn't cause much pain. So that's kind of why that's the magic number. Unless do you have any other wisdom on that?
I just know as far as the amount versus the medication, it can also be determined based on if that medication could cause like skin breakdown or irritation at different levels of dilution.
Yeah. So you wouldn't want to use, you wouldn't want to use 0.2 cc's to dilute your Menopure. Might it dilute? Yes, but it would be so strong. Concentrated that it could cause tissue irritation and that type of thing. So Kayla is saying OHSS is no joke. Yes, it is no joke. And so we've talked about this previously, but if we tell you there's not going to be any HCG for trigger, you're not going to be doing a fresh transfer, because the HCG, if it comes from the trigger or the pregnancy, is going to cause the same issue, which is a flare up of that OHSS. So, okay. So Christy was asking, will we speak to a nurse about this? Yes. So we always release your written instructions for your own convenience so that you can go back, you can read them. I like to have them printed out. I know not everybody has a printer, but to just be able to cross out each individual medication as you take it. But we will always call you to discuss this. There's times where we might get your voicemail or something like that, and we'll leave a very detailed message, but we'll always release those written instructions too. Just that way we're all on the same page. The more we can reiterate it, the better.
Hey, Elizabeth, before we get to PIO, can I make one mention about HCG real quick?
Yeah.
I think it's a good opportunity for us to slip in what we often talk about together, which is that comparison is the thief of joy. Yep. And that with HCG, I know how common it is. I get questions all the time of my friend who went through IVF, or I read online in my support group, and I totally get that. But as you're explaining so well, it's a personalized, customized medication dosage specific to your instance. So we're not looking to hyperstimulate you. We want to do what's right, that's going to get us the best outcome. And in doing so, based on thousands and thousands and thousands of cycles, there's been all these studies done to determine that. So even though somebody next to you sitting, going for monitoring, maybe doing HCG, and it sounds better for them, and maybe it is better for them, that might not be what's going to work best for you.
Yep. So just know, exactly. That's such a good point in that. And I get that a lot. And I find clients who become quite anxious over that because they say, well, my sister-in-law did this and she only did, this or that. And just know that we really do pride ourselves on taking your individual case and figuring out what is your best case scenario for a successful retrieval with nice, mature, healthy eggs. So, okay. So let's talk PIO, and then we're going to come back. We're going to talk about some of these other kind of questions that people have been asking. So, dun, 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 except for not really, right? So I think, and share what you're thinking, but I really think that PIO is nerve-wracking in that it's different, right? We've been doing these short little subcutaneous needles. They don't hurt so bad. We can do this, but there's some type of mind block, I think, that comes in with a 1.5 inch needle that's got to go in my backside. I can hardly see where it's going to go. And there's just a lot of horror stories out there about it, when I think in reality, it is, it's so doable.
It is.
It's so doable. So teach us how to do a PIO injection.
Progesterone and oil, everybody's probably heard about it. We'll talk about how important it is, because really this wouldn't be done if it wasn't absolutely necessary, and it is. So it comes in a multi-dose vial. You're going to use this vial more than once. So you'll always clean the top of it with alcohol. It comes on an oil base. So it's a thicker fluid. And because of that, we give you these 18 gauge, 1.5 inch syringe needles that you're going to put on the syringe, but you're never going to inject with 18 gauge. They come in a pink little package. And I usually say, if you have those in a baggie, to put on those mixing only PIO.
Yep.
So you're going to go ahead and twist on that pink needle. It's going to look huge. This is where I think what you're saying about just that mind kind of block is, it's visually
Intimidating.
intimidating. And so
Yep.
what I usually say is, look at these a couple of times before you're ready to start your PIO injections. Hold it like a pen, kind of just like keep it in your hand, and know that it's okay. It's just to mix. You're going to go ahead and you're going to take off the cap, and you're going to pull down. Now, is the dose that you guys are standard with 1 ml?
Standard is 1 ml. Yep.
Okay.
So obviously follow instructions. If you've had a previous cycle where we've discovered maybe a little bit more progesterone was helpful, sometimes we do 1.5.
Okay.
But yeah, standard is going to be the 1 ml, which is equal to 50 milligrams of progesterone.
So you're going to go ahead and you've pulled down to 1 ml of air. You're going to put it in the top of the vial, squeeze that air in, hold it upside down. And again, you're going to make sure that the tip of that needle is under that oil level, so you can pull down to get 1 ml of oil. This is kind of weird. When you're pulling down, it doesn't come down like it does with water because it's oil. So it takes a little bit of pulling. So sometimes you have to push up and push back down, and that's totally fine. Once you have your 1 ml, you take it off. You're going to recap. So you're going to put your cap down on the table, scoop it up, push it on, twist it to the left to remove. And then you're going to take a 22 gauge. Are you guys using 22? 1.5 inch?
Yeah,
So
primarily 22 gauge, 1.5 inch.
1.5 inch needles. And this is what you're going to inject with, just to be straight up and honest. So the way that I usually teach this is to say that this is what you are doing to promote and hopefully encourage implantation, maintaining a healthy pregnancy, and having a beautiful outcome. So it's something that, you just wrap your head around. It's going to be done. And I've always put the twist on it, if lucky enough, for a long time, because then you're supporting a pregnancy, which is ultimately the goal. So what you're going to do is on your backside, and I teach this different ways, but I'm wearing jeans right now. If you have your jeans pockets and you go to the upper outer corner of your jean pockets, that's kind of where I start to give like the area. I've had diagrams that I kind of draw sort of just our backside, just like this. We're not going to do it down here. We're not going to do it in the middle. We're going to do it in the upper outer corners, more towards the hip area. And what we're going to do is we're going to clean the area with alcohol. I'm trying to see if I have a bigger injection pad to actually, I do. Let me see if I could use this. Yeah, let's go with this. We're going to go ahead. I'm going to pretend this is my backside. We're going to clean the area with alcohol. We're going to hold this again like a pen. Even though it's really big, it's even more important to make sure we have full control over it. And instead of pinching up the skin like we did with all the other shots, we're actually going to stretch the skin. We're going to actually create a little bit of tension in that skin because it's going to make the needle going faster and easier. The trick to this, the name of the game, all of it, is that I tend to say, when I'm watching people or I'm seeing them do it to kind of, confirm and encourage they're doing it the right way, going in really slow is going to be more sore. If you can get your wrist involved, your partner, if you have one, and go 1, 2, 3, straight in, push down. It's going to take a few seconds to inject that in because it's an oil. Stretch the skin and pull it out. You're going to reduce, I hate to use the word, but drag on the needle. It's going to come out faster. It's going to go in faster. And then as soon as you're done, you're not going to lay down. You're going to move around. You're going to make sure that oil is getting dispersed through the muscle. Take a warm, wet washcloth maybe and massage the area. It's going to help disperse that oil around so we can avoid clumps and little bumps under the skin. And I'm sure, Elizabeth, you can speak to that a lot.
No, absolutely. And we're getting a couple questions about it too. So I always recommend ice before and heat after. So I noticed somebody said they always do heat before and after. Bree, if that works for you, do not change it. But when you heat an area, you're dilating the blood vessels. You're going to make it, typically it's going to hurt a little bit more because all of those nerve endings are like wide open. So if you ice it beforehand, not only will you feel it very minimally, but that like feeling of the oil sometimes, like Linda said, it goes in slowly. And so the fear of all of that, the needles in, it just helps to kind of diminish those feelings of fear. So I always tell this story. I know if those of you who watch me a lot have seen me talk about this, but when I was doing the PIO injections, I had a couple of trips planned. And then just like we all have life. So all of this crazy stuff, we're trying to fit into the other very busy parts of our life. And so one thing that Linda and I a lot, we talk about is organization. So Linda was mentioning like sticky notes, like this is for this, this is for this. But one thing that I loved to do for my progesterone was, if you've ever seen the little snack size Ziploc bags that they're like, I don't know, about 2 or 3 inches tall. But basically inside one of those, I put the needle, the injecting needle. So as she showed you, there's the 2 different. So you're going to have the pink needle, the big, thick, scary one that you're never going to inject with. And then you're going to have that 22 gauge exactly. So both of those go inside the plastic bag with an alcohol wipe and get sealed up. And then that gets put inside a second baggie. And I always used the second bag for ice.
That's
so
great.
Pretty much no matter where you are, if you're in an airport, you're at a restaurant, no matter where you are, you're home, you can take that second bag, put some ice in it, and just kind of tuck it in that spot so that as you draw up, you put the big pink needle on, you draw it up. As you're doing that, you're kind of numbing that site. And then injection is truly not horrible. And the times that I was without ice, which was like just a few times, I was just like dreading it because I was not good at going quick. I had a little bit of a mind block on myself about injecting a 1.5 inch needle really quickly. But the beautiful part about having the ice was I didn't have to do that. Because if I hesitated and I went slowly, it still didn't hurt. Yeah. So ice before, heat after, and just like Linda said, try your best. I know most of us do the progesterone injections in the evenings just because with work and time wise, and if we have a partner, et cetera, it's just easier. But you definitely don't want to just inject it and then just go to bed or just kind of sit on your bum. So my 2 things are: take the dog for a walk. If you have a dog, take him for a walk around the block. Or if you have stairs in your house, go up and down your stairs just a couple of times, get that muscle working and revved up so that it can begin that process of absorbing that oil. And then if you don't have steps or you don't have a dog, what you can do is lay in bed on the opposite side of the side you injected, and then just kind of you can do leg lifts or bring your knee to your chest a couple of times. Just getting that muscle working helps that oil to not just kind of sit. It helps it to start the process of starting to absorb. So quick. Yeah. So someone's saying I have a lunch box. I keep my needles and syringes and PIO alcohol wipes. That's genius.
Love it.
Somebody's asking, and this is such a wonderful question for Linda. What do you think of the auto injector?
That's a great question. I will say this. Do I think anybody needs the cost or the added expense? No. I know in 15 years, everyone can do this. I know that. Yep. Willy Wonka the dog is barking in case anybody hears him. I think it's great if you're either on your own, you have an absolute phobia of needles, and you feel like it will make your life easier. I am all about whatever's going to make your life easier and it's going to keep you calmer and reduce stress and anxiety. But I know it can be cost prohibitive for a lot of people who are putting everything they can into this cycle, and the cost is just astronomical. And so I think it's okay. I think it's good. It's very useful. I know some people that have loved it. I know some people that felt like, you know what, I didn't really need it. So it's one of those things that I can't really say one way or the other, but I think it depends on the person. A couple of things about PIO that I strongly recommend. If you're on your own with your partner, whoever, a friend, whoever you're with, when you're doing it, maybe stabilize yourself. I usually will say, like, lean over on a table or get yourself comfortable on the couch or on the bed with maybe a pillow, so that your body is not going to subconsciously make you jolt forward or jump when the needle is coming towards you, because I've seen that happen a lot. I do stress a lot. I know we've talked about this analogy. I view progesterone as when you give it to yourself, you pat yourself on the back. That
Yep.
is something you are doing directly to help get to your goal. And it's creating, you can visualize in your mind this like fluffy pillow in your uterus, right? It builds up a thick uterine lining so that this embryo can implant and get really comfortable and continue to grow and stay there. And it is essential to maintaining pregnancy.
Yep.
So it's just an all out wrapping your head around that, knowing that it is uncomfortable. I don't think it's right or appropriate to say that you're not going to experience discomfort with that one. It is uncomfortable over time, especially, but there are ways that you can manage it and you can get it done, and it will absolutely help.
Yeah. Yeah. And just piggybacking off of that. I mean, I know for me, it really was to a point of like, oh my gosh, I'm lucky enough to be at this spot. And then the further you go, every shot becomes this rite of passage. Like, I'm this much closer. So the reason we use PIO, just in case anybody's wondering, is because in an IVF cycle, or especially in a frozen embryo transfer cycle, where you have your period and then we plan the transfer without any regard to your ovulation. We don't really want you to ovulate in a medicated FET cycle. If you do, it's okay as long as it's after we start the progesterone. But the progesterone is what is supporting the pregnancy. Progesterone for pregnancy. It is the pregnancy hormone. And the reason why I have people ask all the time, well, can I skip the progesterone oil? Yeah, you can skip it, but there's a reason why it's the gold standard. And that reason is because it absorbs equally and it absorbs evenly over 24 hours. Mm-hmm. So that oil kind of spot in there is just slowly being absorbed into your bloodstream and supporting that pregnancy. And so that's why we, it's such a big deal. And so, yes, you certainly can skip it, but we're going to have to support that progesterone from somewhere else. And really none of the other options are as strong and steady and proven as the progesterone. So totally. That's just kind of my little blurb on that one. So let's see here. Are there different types of progesterone? As somebody's asking, what are the different forms of progesterone that you're familiar with?
So if you have an allergy or reaction to it, where you're having hives or you're getting itchy, it's compounded in an oil. There's different types of oil. So we can do it depending on what you need, rather sesame oil, olive oil, ethyl oleate. So there are options. So for instance, Metro is a compounding pharmacy, it's full service. So we can do any of those. Some people have sensitive skin and they don't know for 4 or 5 days into it, and then they start having a reaction. It's not very common, but it does happen. So there are different oil bases, but it's an oil. So regardless, you're still going to draw it up the same way. You're still going to administer it the same way.
Yep. And so that's with regard to the oil. There are different formulations. So if one seems to be really is seeming to be, indicative of maybe a reaction, then that's when we can switch oils. Obviously, if you have a known allergy to nuts or things like that, sometimes in that case, we're going to not give you sesame oil. There is ethyl oleate, which is basically a hypoallergenic oil that it's suspended in. But then there are also, you can take it orally, you can take it vaginally. We don't really use any topical progesterone for these types of cycles, but that is certainly an option. So, if there's, while Linda and I can both be the very first, the two people to cheer hard for you that you can do this, there might be an instance where you can't for a number of different reasons. And so always check in and see if you've got a hesitation, we can talk through it. If we think it's appropriate, we can add things like oral progesterone or things like that. So, So any other last minute thoughts or or anything else you want to add? I mean, we're kind of over our hour, and I think we've answered the majority of the questions. So
Good. I feel like we have so
can,
much we could always talk about. We
I
could
know,
going
I know.
on and
We can
on.
go on for hours and hours and hours. So, but it's such fun to go over this stuff, to sort of minimize the fear that's around it, because there's so much fear about the unknown. And so just talking about it, like Linda said, like if you have your meds and you feel some sense of anxiety about them, just pick them up, touch them, look at them, familiarize yourself, make friends with them, realize that they are helping you get to your goal. And so I guarantee, I have worked with some patients over the years that have had their self-proclaimed absolute complete needle phobic, and they've done it. And so I hope that is positive for you. I am getting a couple of questions about, is it okay to use like a menstrual cup with progesterone suppositories or inserts and things like that? I personally don't recommend that. I think that sometimes what can happen in that situation, I understand the reasoning behind wanting to do it, because let's all be honest here, it's a complete mess, the progesterone suppositories. But what tends to happen is the progesterone itself drops into the cup.
Yep.
And then it can't be absorbed to where it needs to go.
Yeah.
And so I think that is a mistake, using any type of, definitely no like tampons or things like that, because then the tampon is going to absorb the medication, or the menstrual cup. Yeah, exactly. So I think panty liners are our best friend. It is so obnoxious. It's so gross, but there's a way around it. It is relatively short-lived, but I would not use any type of barrier, because I think what's ultimately going to happen is we're going to decrease absorption, and that's what we don't want.
That's a great question. That was fantastic.
Yeah. No, it's a fantastic question. So, all right. Well, we will end it there. Thank you all so very much for joining us. Linda is so kind to hop on with us, usually about once a month. So stay tuned in about a month for another Medication Monday. She's got her Instagram up at Unbox Mom. So if you find that you have questions for her and you think she could help, certainly reach out to her. Anytime. And then obviously your patient portal is your best friend. If you find that you have questions, there's no wrong question. There's no dumb question. This is all so overwhelming, and we all come at it and come to it with a different set of circumstances. And so own those, give yourself permission for those. And, we'll continue to support you from our end in any way that we can.
Yep. I hope this reduces fear. I hope it's empowering by showing all of this and being transparent about what it is and what to expect. It's not meant to make it more overwhelming. It's helped to actually provide info and feel as if, okay, this is what I can expect, and I'm going to be able to do this. Yeah. And you have all of our support.
Absolutely. You have all of our support. So that's it for tonight. Thank you all so much for joining us. If you do have questions, cnyfertility.com. Check out Linda at Unbox Mom on Instagram, and let us know. We are here to help. We're here to support. We hope you all have a wonderful, wonderful week.